So okay, as a continuation of our vital signs, so we're through with the temperature, assessing the temperature. We will now move on to assessing the peripheral pulse. So katulad ng sabi ko dun sa may nakaraang video, kailangan while taking the temperature of our client, simultaneously ginagawa na rin natin yung ibang vital signs or ina-assess na rin natin. Okay? So ang susunod dito sa pag-assess sa may vital signs natin will be the pulse. So first we need to assess. You have to assess for any clinical signs of cardiovascular diseases, cardiovascular alterations, other than the pulse rate, the rhythm, or the volume. Kung ang client natin is mayroon talagang problema sa kanyang heart, so we need to expect na yung pulse na makukuha natin dito is inaccurate, or we can simply say na merong discrepancy. Okay? What else? Any factors that may alter the pulse or may alter the pulse rate, such as activities, ano pa? Sudden changes in the position of our client, ano pa? The environment itself, pwede rin maka-apekto yan, lalo for example ngayon, summer, mainit, it may alter also the pulse. Ano pa? The activity of our client, kung ang client natin is merong tinake na medications, pwede rin natin ma-alter yung pulse rate natin. What else? Site most appropriate for the assessment. So for this procedure, the most appropriate and accessible is what? The radial pulse. Okay, so dito tayo kukuha. Okay? So may radial pulse niya. Sir, pwede rin po ba sa may brachial? Definitely pwede. Sir, pwede po ba sa may apical? Pwede po ba dun sa may carotid? Definitely po pwede. Kaso nga lang, pinag-uusapan natin dito is the appropriate for the assessment. Appropriate ba na kuhanan mo ang pasyente ng pulse dito? Appropriate ba na kuhanan mo ang pasyente, kuhanan mo ng pulse ang pasyente dito? It's not really that appropriate. It's kind of awkward. Okay, so doon tayo sa may pinaka-accessible, which is the radial pulse. So sir, paano po pagka wala? Then, you have to look. There are actually 9 pulse points. So doon ka mag-assess. Okay? What else? You also have to determine the policies and procedure ng facility kung saan ka nag-duty. Okay? Because different facilities has a different protocol, different procedures, different policies. What else? We also need to determine if our client took medications, because there are some medications that may really increase or decrease the cardiac output or the pulse of our client. So after the assessment, we will move on to the planning. So ano yung may dapat nating planuhin for this procedure? So we have to assemble the equipment and the supplies. So meron ba tayong kailangan dito na equipment? Meron ba tayong kailangan dito na supply? Actually, wala. Pero kung ang client natin is pedia, okay, so there's a possibility na may madagdag dun sa mga supplies natin. Do you still remember the 4 techniques na ginagamit natin for the assessment? The IAPP, the inspection, auscultation, palpation, and percussion. For this procedure, in the assessing the peripheral pulse or the pulse itself, ang technique na gagamitin natin is what? Palpation. Pero kung ang case po natin is pedia, hindi tayo gagamit ng palpation. Hindi natin ipapalpate yung pulse ng pedia. Instead, we will use another supply, or should I say equipment, which is a stethoscope. Gagamit tayo ng stethoscope, and ang technique na gagamitin natin dito is of course auscultation. I-auscultate natin or papakinggan natin yung kanilang pulse. Okay, papakinggan natin yung kanilang pulse, hindi po tayo magpapalpate. Okay? So what else? If ever naman that you're going to use a DUS or the Doppler ultrasound stethoscope, of course, you have to ready all those things, if ever lang, which is very rare naman na mangyari. What else? After assessment, after planning, let's move on to the implementation. Again, prior to performing the procedure, you have to greet your client, introduce yourself. GIVE, or give. Greet your client, introduce yourself, verify your client, and then explain what you're going to do, how your client can participate to that procedure. What else? So, katulad din sa mga nauna, you have to wash your hands before and after the procedure. And always remember to observe the infection control procedure. Okay? Kung hindi available ang sink, kung meron ka namang alcohol, so you can use the alcohol to sanitize your hands. Okay, what else? Pa ba kailangan natin dito? If you're going to use a stethoscope, okay, be sure lang din na lilinisin mo yung earpiece, and then if you're going to use the diaphragm, okay, then you have to clean it also with sanitizer, or if you're going to use a cotton balls na merong alcohol, better. Okay, para mas ma-disinfect natin. If, sir, kailangan po ba namin gumamit dito ng gloves? Gagamit ka lang ng gloves, katulad ng sinabi ko na nakaraang video, if ang pasyente natin ay merong meron siyang communicable disease. Okay, kung wala naman, please lang, huwag kang gagamit ng gloves. Okay, what else? Provide privacy to our client. Again, privacy curtain. Kung kinakailangan yung kumot, why not? But for this procedure, since we're just assessing the pulse, okay, kahit na wala namang privacy sa may client natin, if she is in the hospital, walang problema ron kasi you're just palpating the radial pulse. Okay? So what else? You have to place your client to the appropriate position. Kung pasyente natin is comfortable siya sa may supine position, hayaan natin yung pasyente natin na nakasupine, huwag natin siyang itatayo. Bakit? Baka ang pasyente natin meron siyang orthostatic hypotension, biglang magbabago niyan yung kanilang pulse, the pulse rate. Pwedeng magbago yan. So, kung nakahiga sila, hayaan lang natin sila nakahiga. Kung nakaupo sila, hayaan natin sila na nakaupo. Okay? So, what else? Select the pulse point. Ang pulse point na gagamitin ko rito or kukuhanan ko is what? The radial pulse. Okay, this is the pulse point. Okay? Next, you have to assist your client to a comfortable position. Kung ang pasyente ko rito is comfortable with the semi-foulers, hayaan natin siya ron. Okay? Next, palpate and count the pulse. Okay? So, in doing that, we will use our 3 fingers, the index, the middle finger, and then the ring finger. Itong tatlo po na to. Pero minsan napapansin ninyo sa other healthcare workers, ginagamit lang nila is 2 fingers. So either of the 2 is okay lang naman, pero there's actually a rationale kung bakit tatlo ginagamit, and that is something that you have to include in your video. You have to explain anong rationale bakit tatlong daliri ang ginagamit natin when it comes in the palpation. Okay? I mean, in palpating the pulse of our client. Okay? Place it here, and then if, according to sa may book ni Kosher, if this is your first time na i-assess ang pulse ng client mo, to draw or make a baseline, okay, count for full minute. Kung hindi naman ito yung first time, at least 15 seconds i-count mo. Okay, for example, in 15 seconds, naka 15 pulse point ka, 15 rate ka, okay, 15 beats per minute ka. 15 beats in 15 seconds. And then multiply mo na lang yan into 4. Nang sa ganun, makover mo yung 60 seconds or 1 minute. Okay? Pero guys, we do not recommend that. Okay? Even in the hospital, we do not recommend that. Kailangan kapag kumuha ka ng pulse, okay, kailangan full minute lagi. Bakit? Accuracy of the data. Kung 15 seconds mo lang kinuha na yan and then minultiply mo into 4 para maging 60 seconds, okay, sometimes hindi po accurate yung data na yun. Kaya we recommend and we suggest to our students laging full minute. Pag nakita namin ang student namin na 15 seconds lang yan, kumukuha ng pulse, okay, questionin namin yan. Sure ka ba doon sa data sure ka ba doon sa may information, doon sa may pulse rate na nakuha mo? Ilang beats per minute yan? Sure ka ba? Okay, kaya we recommend full minute mo dapat kinukuhanan ng pulse ang pasyente natin. Okay? So, put your index, your middle, and then the ring finger, and then palpate mo for the pulse. Hanapin mo saan merong tumitibok. Okay, dapat light lang okay, over the pulse point. Okay, kapag ka nakapa mo na kung nasaan yung beat, okay, nandun ka na sa may pulse point, and then count mo na yan. Count for full minute. Okay, we recommend to use yung mga analog watch, hindi po yung digital, okay? We use yung watch na merong second hand. Kasi doon ka magbabase ng pagka-count. Kung ang watch mo is G-Shock tapos digital yan, we do not recommend that, especially in the duty. Kapag ka nasa duty tapos ang isang estudyante is he or she is wearing a digital watch, especially G-Shock, okay, branded pa talaga, no? Okay. Slash yun doon sa kanilang uniform. Kasi ang watch mo is part ng uniform. So, if you're not wearing a watch na merong second hand, it's a big no-no. Again, hindi po dapat digital. Sir, paano po pagka G-Shock po yung watch ko? Okay, meron naman pong dalawang kamay, ang wala lamang po is yung pang seconds. Paano po yun? It's a big no-no din. Bakit? paano mo mabibilang in full minute? Sir, meron naman pong digital yun eh. Okay, again, hindi din. Hindi tayo magre-rely dun sa may digits na yon. Kailangan na gagamitin ninyo is yung watch na merong second hand. Okay? So, kapag ka yung second hand niya is napunta na ron sa may 12, mag-start ka ng magbilang. Okay? 1, 2, 3, 4, 5, 6, so on. Kapag ka nagbibilang ka, huwag kang tingin ng tingin dun sa may watch mo. Kaya naman, pag nagbibilang ka, huwag kang nakatingin lamang dun sa may watch mo. Bakit? Sometimes, nagsisynchronize yung pagbibilang mo dito sa may pulse doon sa may pag-tick ng second hand. Baka ang nabibilang mo na is yung pag-tick ng second hand, hindi yung pulse. Okay? So, kung tumapat na yan sa may 12, mag-start ka na magbilang and then i-estimate mo na lang. Pag malapit ka na ron sa may full minute, okay, tumingin ka na ron sa may watch. And that's it. Okay? And then i-assess mo rin, meron bang irregularities? Okay? Malakas ba yung pulse dito? I-assess mo na rin at the same time. Assess the pulse rate and then also the volume. Okay. So after mo makuha, ang nakuha ko, let's say for example, ang nakuha ko dito is 75. That's a good one. Normal tayo. Then we will now move on to the evaluation and the documentation. So you have to document the pulse rate in the vital signs record sheet. Okay, doon mo rin nilalagay yan. Katulad nung sa may temperature ng pasyente natin. Okay, yung nakuha natin data doon sa may temperature, sa may pulse, sa may respiration, sa may blood pressure, lahat yan ilalagay natin doon sa may vital signs record sheet. Again, separate video ang gagawin ko kung paano natin ilalagay yan sa may vital signs record sheet. Okay, next, you have to report any abnormalities sa may primary care provider natin, primary healthcare provider, or kung ikaw, student ka, i-report mo yan doon sa may CI mo. What else? So, si CI, i-double check niya yan, and then if there's really a problem, okay, refer yan doon sa may staff nurse natin, and then si staff nurse ang kukontak kay doc. Okay, what else? Document the pulse rate, the volume, the rhythm, all the information na nakuha mo with regards dun sa may pulse ng client natin. Ilagay natin yan dun sa may nurse's remark sheet. Okay, susulat natin dun yung nakuha natin na information o yung naging assessment natin. Okay, so, yeah, that concludes the return demonstration for the pulse. So, again, kuhanan mo lang siya. Then, pag nakuha mo, done. Okay, but bago mo ibaba itong kamay na to, okay, ilalagay mo itong kamay na to dito sa may, okay, sa may stomach. Anong reason bakit natin ilalagay dito? Okay, yan yung susunod na video. Okay, it has something to do dun sa may susunod na vital signs. Okay, so paki-check nyo na lang yung susunod nating video. Okay, for any questions, you can just send a message or ask me during our consultation time. Okay, so that concludes our discussion for the pulse, or should I say assessing the peripheral pulse.